Why does BPH cause recurrent urinary tract infections? Imagine a busy highway where traffic suddenly slows down or gets blocked. That's similar to what happens in the urinary system when benign prostatic hyperplasia causes trouble. BPH is when the prostate gland enlarges, usually around the middle-aged or older men. This enlargement presses against the urethra, which is the tube that carries urine from the bladder out of the body. When the urethra gets compressed, it causes a blockage or narrowing, making it harder for urine to flow freely. Because of this obstruction, the bladder has to work harder to push urine through the narrowed passage. Sometimes, the bladder doesn't empty completely during urination. Instead, some urine remains trapped inside. This residual urine acts like a cozy hiding spot for bacteria, which can multiply and cause infections. This is why men with BPH often experience recurrent urinary tract infections. The stagnant urine provides an ideal environment for bacteria to grow, leading to repeated infections. In addition to incomplete emptying, the increased effort needed to urinate can cause the bladder wall to become thicker and weaker over time. This weakening can further impair the bladder's ability to empty properly, creating a cycle of urinary retention and infection. Other complications that can develop include bladder stones and damage to the bladder lining, both of which can also increase the risk of infections. To manage these issues, doctors may recommend treatments that help reduce the size of the prostate or improve urine flow. For example, procedures like transurethral resection of the prostate can remove part of the enlarged tissue, relieving the obstruction. When urine flow improves, the bladder can empty more completely, reducing the chance for bacteria to grow and thus lowering the risk of recurrent urinary tract infections. It's important to note that while BPH causes these urinary symptoms and infections, it does not increase the risk of prostate cancer. However, because symptoms of BPH and prostate cancer can overlap, proper evaluation by a healthcare professional is essential for accurate diagnosis and appropriate treatment. If you experience frequent urinary infections or difficulty urinating, consulting a healthcare provider can help determine the best course of action to improve your urinary health and reduce infection risk.